Hey, welcome. You're watching Northern Soul. Today we're doing kinesiology taping on what is commonly known as shin splints. So it's like shin pain, shin or knee pain, and will be included with flat feet or support of the arch because this is one of the problems that includes the muscles that support the arch as well of the foot. Also known as medial tibial stress syndrome, posterior compartment syndrome. So the taping's pretty straightforward. We're going to need two eye tapes. Typically, I'm going to use contrasting colors here. And this is something that's very common amongst people that play rugby, soccer, stuff like that, football, things like that, with running on hard surfaces and stuff like that. Definitely be a massive problem. You get pain usually on the inside, the medial aspect of the tibia. And if kind of left unchecked, you got to watch it because you could have one of those things where it could. There's a few things it could be. So if it's not shin splints, like in the musculature, so we're talking the muscles commonly referred to as Tom, Dick, and Harry, which is in the medial aspect of the tibia. So or tibialis posterior, flexor digitorum longus, and flexor hallucis longus, commonly known as Tom, Dick, and Harry. Now, you just got to watch for if you haven't had it checked out, just in case it's not like hairline fractures of the tibia. So, like I said, you might want to get go to the doctors, get an X-ray, get some imaging done just to make sure it's not that. Otherwise, the other thing to watch out for, if you continue to do, which I have done, where I just continue to play because you're playing in a season, right? So you're not going to stop, and it's like footwear that doesn't have any cushioning. And in my case, there was a field where it wasn't even, it was like a drought for like months. So the ground was like concrete, basically. You're just stomping on the ground, just crushing your bones, basically, and just putting shockwaves through the musculature as well. And I definitely had that. It would get better at rest, but then it would aggravate upon use or with any sort of running on that hard surface again. It would get really painful. So I'm going to show you the taping for that. Watch out for if it gets very uncomfortable, very painful, because there is a condition in which case there will be inflammation within those muscles, and it'll there's nowhere for the pressure to release. If it starts to swell up, you get edema, and then what can happen is that the pressure can actually crush the muscle cells and kill them, cause cell necrosis just based on pressure. So there is an emergency procedure for that where they actually just cut the fascia. So you go to casualty or emergency, and they'll diagnose this and say, oh wow, okay, there's whatever, a lot of we need to relieve the pressure before it kills the tissue, and they'll actually just take a scalpel and just cut it open. And lots of fun. Yeah, I know, hopefully none of you passed out listening to my awesome story, but that it is an actual medical emergency. So good to be aware of it. I don't want you to be scared, but just be aware, because knowledge is power. So, but here's some taping that can help you if you already have a version of it, or you're trying to prevent it, or you're trying to just get through your match, because you're obviously very important that you need to continue on anyway. So let's do the taping. Okay, so we're going to do taping for this this one taping. It'll also be affecting the arch of the foot. So we're going to be adding support to that across the ankle. So you'll have 0% stretch across there, around the ankle, and then up to where the tibia is. So you can feel the tibia, there's a bone there. And you can just kind of get under the ridge of it. That's the muscle aspect of it. So you're going to be taping all along that. So it's going to be under the foot, like down here. So we're actually going to put it into position like this. Add a little bit of stretch up until the ankle. Once we get to the ankle, no stretch, all the way along just the interior of the bone right there. So I'm just going to back this off slightly. There we go. And for those of you that are new to taping, you can also check out my 101 taping video as well on Northern Soul channel, as well as the comparison taping for the different tape manufacturers, to see, kind of get an understanding of the different brands and how they react and how they work. Okay, so I'm just gonna like pull the arch like this so that I have good access to it. Kind of get to where is the ball of the foot right there. So 0% stretch. Hopefully you can see that like that. I'm gonna add a slight stretch to it just to get to the ankle. All right, and then I'm going to evert at this point and point my toes to my nose. I'm gonna get to right about there. So we're gonna switch over to no stretch. Come around the ankle, like so, and then find the ridge of the tibia. So that's the shin bone, as a lot of people refer to it. You can just get on the other side of it where the calf starts to show out here, and you can get under that, and you just want to follow that with no stretch. There we go, no stretch. So just a bit of the stretch along just here, and then you're going to anchor it, and then switch positions, evert, and then dorsiflexion, so toes to the nose, and then you're going to place that portion along the tibia here. The painful area should be located around here, so, and you want to make sure you run that over, so that's included within that strip. So aim for that and then go past it. That's that. Okay, next part is we're going to be, so you got to find the painful spot here, wherever it is. So I don't have shin splints, so I'm just gonna come up with something. So I'm gonna say it's about here. So I'm gonna start posterior of the calf, right in there, and then move over across with substantial stretch, so not about 75% across into what would be the outer thigh area. That's where I'm going to stop. There's going to be substantial stretch, so you may wish to back off a little bit in order to save some tape. Like that. Round off the ends as normal. Okay, so you're going to go directly across. So say this is the painful area. So I'm going to want to start horizontally, just back of that. No stretch on the anchor. So just back here in the calf. I'm just going to anchor that. And then I'm going to apply. So I'm not going to go all the way with this, but I'm going to stretch it out. So 100% back off to about 75. Right across that painful area. And then start to bring it up towards. Now you'll want to start to just have a slight bend in the knee. And continue with the stretch as well. So 75 up into towards, so 50 to 75%, depending on what your tolerance is for your skin, towards the outer thigh area. Just like that. So we're going to rub that in there so it adheres. Remember, it takes about 10 to 15 minutes for it to get to almost maximum adhesion. Otherwise, if you're going to do any sort of wet work, so swimming or showering or any of that stuff with water, you'll want to wait an hour before you engage in that activity, so that this doesn't end up washing off, because that's when it develops its water resistance, about an hour into settling into the taping. So that's what that looks like. So yeah, it's posterior compartment syndrome, shin splints, taping. Stretch here to add, to accentuate the healing effect with circulation increase, and helps with the very painful. So you have an almost like a plus sign or a cross over the actual painful site. And we got some support in offloading the muscles this way, including the actual angle of the arch of the foot. So thanks for watching. Think about subscribing. There's just a ton of other videos on there. If you have any sort of other tapings, you're like, hey, I wish to know how to tape this or whatever, put it in the comments, and I'll hopefully, if I select it and have time, I'll make up a video. Otherwise, if you have a question or whatnot, throw it in there if I have time. if I have time, I will answer as many as I can. And thanks so much for your support and watching. And I'll see you next time on Northern Soul. Peace.